So obviously, these are kind of like we're checking for like chest pain type things, right? Ruling out MIs, right? So I guess the cardiac biomarker we're going to most look for is which one? Troponin, right? Because it's considered unique just to the heart muscle, so it shouldn't be others. So we all learned that. So, and these are some of the times, right? These are always 1 to 3. Troponin. Basically, it's something if anybody comes into your office with chest pain, it would be a good idea. See if they're in your primary care office, you cannot measure troponin serially, right? Because they tend to go home and they don't stay in your office.
You can do an EKG.
What's that?
You can do an EKG.
You can do an EKG, and now there are like instantaneous troponin ones, right? In your office troponins you can measure. You could use it to support a diagnosis. Right? But you wouldn't do it serially in your office. There's no sense. How can you do it? You come back tomorrow. If you really think they have an MI and you're asking them to come back and come back, you shouldn't probably have them in your office. So, okay. So there's other markers we use, and we do use those as well, but they're not unique to heart muscle. So they can be also skeletal muscle or skeletal muscle injury. Weightlifting might elevate these values. Right. What's that?
What CBK is that?
This is just in general, right?
Yeah, the
CPK,
CK.
right? CK, they abbreviate it as. And there's different ones. CKMB, but it's considered less sensitive and less specific than troponin. Remember about sensitivity and specificity?
Yeah.
So what would something that's less sensitive and less specific mean?
It's not the best test.
It doesn't have a good
Say
percentage
nothing
of
else. You can say it in a
sensitive.
very general way. What's sensitivity again?
The more sensitive, the more true positives, the more specific.
Okay, true positive,
True
right?
positives,
So it
yeah, that's
detects
what it is.
people with the
The higher
condition.
percentage of
So there's
having a
less people getting
condition.
detected with the condition. And specificity?
No.
That was good, but you got the first one. Anybody? Well, you're there. You're there. Anybody want to help her with specificity?
Isn't it the false negatives?
Something negative.
The specificity is the true negative.
It's true negatives. You're right. It's true negatives. It's the actual. It's the true negative percentage. It's the percentage of people who don't have disease and test negatively, right? So it's not good at. It's not as good with troponin as detecting true positives and true negatives. So it would be good if we did not have a troponin, but it is not considered the ideal. So we do BMP. Tell anybody know about this? What does it measure? Stretch in the heart, because it's released from the heart when it stretches. Right. So there you go. So you would suggest if it's high that it suggests. What's that?
CHM.
Well, overload, right? Fluid overload, relative fluid overload in the heart. That would really be what it's, right? So they actually serve, right? BMPs, AMPs, they serve functions in the body, right? They're not just, so they're released in the body for a purpose. So when it detects overload, it secretes these, so it increases diuresis, right? It adjusts salt levels as well too, and then changes the pressure. So it's not just a marker, but it's actually active. Even like a C-reactive protein is a utilizable, chemical molecule that gets used in the body. It's meant for signaling. They're signaling molecules. So, see, that was simple. 8 slides. Okay, I guess we're done for today, right? So next week we can bring your stethoscope.